In this episode of the Nurse Practitioner Podcast, Dr. Geraldine Young discusses her role as Chief Diversity and Inclusion Officer at Frontier University and her work with various nursing organizations. What types of initiatives are you undertaking as Chief Diversity and Inclusion Officer at Frontier Nursing University?
As the Chief Diversity and Inclusion Officer at Frontier Nursing University, I am on the trajectory of creating an environment that promotes diversity, equity, and inclusion, and anti-racism, and supports all community members. Our mission at FNU is to produce diverse, culturally competent nurse practitioners and nurse midwives to serve diverse, rural, and underserved communities to reduce health disparities and inequities and improve health outcomes. With the pandemic among us and the massing of health disparities and inequities, at Frontier, we have taken our diversity efforts a step further. We have created a Presence Task Force on Diversity, Equity, and Inclusion, which I'm the chair of. And we're responsible for comprehensively integrating diversity, equity, and inclusion and anti-racism throughout the university. We have developed also a newly Board of Directors Diversity, Equity, and Inclusion Committee, as well to provide an extra layer of support for our efforts, along with a Diversity and Inclusion Committee created in 2015.
Could you briefly tell us about your work with HRSA and CMS regarding the care of underserved and minority populations with diabetes?
Yes, definitely. I can tell you more about that. The Health Resources and Services Administration Health Disparities Collaboratives were initiated to establish leaders in managing quality improvement, a move toward the elimination of health disparities in our nation, and a mechanism for ensuring excellence in practice. The collaborative consisted of a systematic approach to healthcare quality improvement in which organizations and providers created, implemented, and evaluated practice innovations, then shared their experience in an effort to accelerate learning and widespread implementation of successful change concepts and ideals. As a part of the HRSA Health Disparities Collaboratives, I was a coordinator and a provider champion. This project impacted over 20 federally qualified health centers in the southeast region of the United States. It was basically a guide to help organizations to improve health disparities in relation to chronic illnesses such as diabetes, hypertension, depression, asthma, etc., using the chronic care model, which consisted of 6 components to support the quality improvement agenda. These components included health systems, which focused on leadership support and buy-in, the community, connections and partnerships within the community for support, self-management support, a process for equipping patients with the ability to better care for themselves, delivery system design, systematic changes to ensure follow-up with patients, decision support, which provided evidence-based guidelines and support for healthcare providers, and lastly, clinical information systems. These are like your EHR systems or electronic medical record systems and repositories for collecting and tracking data and the outcomes of the interventions that were created. Work with the Centers for Medicare and Medicaid included the Mississippi Health First Project. This project specifically focused on the self-management education component of the chronic care model. I served as a coordinator for this project. This project impacted federally qualified health centers across the state of Mississippi. I was successful in receiving the first CMS and American Association of Diabetes Care and Education Specialists recognition for a federally qualified health center in Mississippi. This set the standard and provided a model of self-management education for diabetes care in the state.
As the co-chair of the NOM Curricular Leadership Committee, what types of work or initiatives are you involved in, and what types of important initiatives or changes do you foresee as upcoming?
As the co-chair of the NOF Leadership Committee, some of the initiatives included reviewing and commenting on current National Advisory Task Force guidelines to provide input on the new guidelines, which are currently in progress. The National Advisory Task Force provides the criteria for the evaluation of nurse practitioner programs to ensure the delivery of quality NP education. At some point in time, in the near future, a new set of National Advisory Task Force quality NP education standards will be released. Suggestions were also provided for the DNP by 2025 workshop presented by the NOF, or the National Organization of Nurse Practitioner Faculties. This workshop involved a plan to guide nurse practitioner programs in the transitioning or initiation of BSN to DNP programs. making a DNP the entry-level degree for nurse practitioners into practice. DNP-prepared NPs are also provided with an additional layer of education to address the complexity of healthcare in the United States healthcare delivery system, providing individualized and population-based care.
Could you talk about your work for the AACN Essentials Task Force on improving diversity and inclusion within nursing education?
Yes, I am very excited to tell you today that the American Association of Colleges of Nursing Essentials have been adopted as of April 6, 2021. I was a part of this task force who created the Essentials. The AACN Essentials are a new model and framework for preparing registered nurses, advanced practice nurses, and nurse specialists. The Essentials delineates competencies, expectations for graduates of baccalaureate and graduate nursing programs. This historic and bold move will transform how nurses are educated for entry-level and advanced roles. The new Essentials also provide a blueprint for how to prepare nurses to thrive in a continually evolving and complex healthcare environment. And the domains for these competencies are knowledge for nursing practice, person-centered care, population health, scholarship for nursing practice, quality and safety, interprofessional partnerships, systems-based practice, information healthcare technology, professionalism, personal, professional, and leadership development. Throughout these 10 domains, diversity, equity, and inclusion will be threaded throughout the Essentials, and this information is directly noted within the Essentials document. So all nursing programs will know the significance of spreading and integrating diversity, equity, and inclusion and anti-racism in the curriculum to prepare our nurses, our future nurses, to be able to provide equitable healthcare services.
Could you talk about any insights you have gained from your Non-For-Leadership Fellowship? Could you share your experiences about any special projects you have been involved with as a fellow?
Yes, I can. I became a fellow through the National Organization of Nurse Practitioner Leadership Mentor Program in 2017. And this is a mentoring program specifically for NP faculty. This program was created in 2012 by Dr. Deborah Barksdale, who is the incoming Dean of Nursing for the University of North Carolina at Greensboro. The purpose of this program is to replenish the pipeline of quality nurse practitioners for diverse and challenging roles in the U.S. healthcare system by ensuring a network of exemplary nurse practitioner faculty leaders to guide leading-edge nurse practitioner faculty in developing academic transformational leadership capacity. This program is still very active at NOF, and I encourage nurse practitioner faculty to apply. Being a part of the NOF Leadership Mentoring Program inspired me to create a comprehensive mentoring program at Frontier Nursing University to provide students with programmatic, specific, and professional support.
Is there any special work or project as a fellow of the American Association of Nurse Practitioners that you would like to talk about?
As a fellow of the American Association of Nurse Practitioners, I'm always disseminating the leadership, scholarship, education, service, and practice abilities that fellows embody. I want the world to know how great nurse practitioners are, and the work of nurse practitioners can help reduce the disparities and inequities and improve the outcomes of patients. Being a nursing professional and making a difference in the lives of others gives me purpose and life fulfillment. These efforts have led to 3 prestigious recognitions this year alone: Diverse Magazine's Leading Woman in Higher Education, the University of Alabama at Birmingham School of Nursing Visionary Leader, and Alcorn State University Notable Female Alumni. Alumni who have gone on to succeed in their respective nursing fields during Women's History Month. I love being an NP.
Is there anything else you would like to discuss? Any message you would like to share with others in the nursing community?
Nurse practitioners are leading healthcare providers in this nation. They work very hard to improve the outcomes of our patients. Nurse practitioners need to be given the ability to practice across this nation to the fullest extent of their education. Again, I love being a nurse practitioner.
This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed in this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer.